Hello, and welcome to the Learning, Leadership, and Professionalism module of Nursing Experts Translating the Evidence. Our objectives for this lecture are to provide an introduction to leadership styles, to discuss the behaviors and actions of successful nurse leaders, to review the opportunities associated with professional organizations, and to briefly discuss formalized continuing education and certifications. There are several different leadership styles in nursing management, each with benefits and detractors in their use and effectiveness towards achieving organizational goals. As a nursing leader, it is important to have a comprehensive understanding of these styles and then to determine how your strengths and weaknesses fit into each of these categories so that you might focus your efforts on improving your present skills and abilities. Coined by Robert K. Greenleaf in 1970, the term servant leadership refers to leaders who influence and motivate others by building relationships and developing the skills of individual team members. Servant leadership in nursing implies that a leader naturally cares about ensuring each team member has the resources and tools they need to succeed. Per Franson, characteristic skills of a servant leader include listening, acceptance, awareness, persuasion, foresight, commitment to the growth of others, and building community within the organization. Transformational leadership is a management style that motivates employees to take ownership for their roles and perform beyond expectations. It is based on building relationships and motivating staff members through a shared vision and mission. Transformational leaders typically have a charisma to communicate vision, confidence to act in a way that inspires others, staff respect and loyalty from letting the team know they are important. They excel at conflict resolution and are masters at helping people do the things they weren't sure they could do by giving encouragement and praise. Democratic leaders encourage open communication and staff participation in decisions. Democratic leadership in nursing can work well to ensure the team feels valued and comfortable speaking up. Workers are given responsibility, accountability, and feedback regarding their performance. Relationships are important to this leader who places a focus on quality improvement of systems and processes rather than on mistakes of individual team members. The authoritarian or autocratic leadership style is demonstrated when a leader makes all decisions without considering input from staff. Negative reinforcement and punishment are often used to enforce rules. Because knowledge is seen as power, critical information may be withheld from the team. Mistakes are not tolerated, and blame is placed on individuals rather than on faulty processes. The positive side of this style is that it works perfectly in emergencies or chaotic situations where there is little time for discussion. It is useful when enforcing policies and procedures that protect resident health and safety, but it does not promote trust, communication, or teamwork when used for day-to-day operations. Authoritarian leaders are often micromanagers. Autocratic leadership in nursing can be effective in making quick decisions during emergency situations. Conversely, laissez-faire leadership is a style in which the leader provides little or no direction or supervision and prefers to take a hands-off approach. The information presented is informative and does not constitute direct legal or regulatory advice. Decisions are not made, changes rarely occur, and quality improvement is typically reactive, not proactive. It is most often used by new, inexperienced leaders or by those at the end of their career who choose not to address issues since things will soon be changed by their replacement leader. Nurses practice in a turbulent, ever-evolving healthcare environment. In order to meet today's challenges and opportunities while strategically planning for the future, it is crucial that we expand our knowledge base and utilization of evidence-based practice principles. Interdisciplinary strategies including collaboration, communication, and strategically driven partnerships are an essential component to assuring we can effectively meet these demands. According to Marcia Hughes Reese, one way to facilitate interprofessional collaboration and accelerate the change process is to identify your stakeholders at the very beginning and develop action steps to ensure their commitment to achieving the goal. Suggestions for stakeholder commitment mapping include brainstorm when stakeholders should be included as a part of the change initiative or could be impacted by the change initiative. Identify the current commitment of an individual or group to the change initiative. Develop action strategies to move the individual or group from its current level of commitment to your desired level of commitment. If you know that you already have some members of a group who support the change initiative, enlist their help in developing strategies to target their colleagues. Determine the critical mass of individuals or groups that you believe is needed to align with the change agenda to ensure success. The Future of Nursing Leading Change Advancing Health report from the Institute of Medicine offers recommendations that emphasize the critical intersection between the health needs of populations and the actions of nurses. The second recommendation calls for private and public funders, healthcare organizations, nursing education programs, and nursing associations to expand opportunities for nurses to lead and disseminate the results of collaborative improvement efforts to redesign and improve practice environments and systems. Collaboration is a cornerstone of public health nursing intervention, and public health nurses can model the way for other nurses and student nurses. Academic practice partnerships positively impact patient outcomes, patient satisfaction with care services, nursing outcomes, and student learners. These partnerships provide a formalized means for academic partners to share educational resources with healthcare institutions towards translating evidence-based practice principles to improve clinical decision-making, increase knowledge of evidence-based practice, and inspire the growth of evidence-based practice population health initiatives. Student learners immersed in evidence-based practice and academic practice partnership settings become experienced in analysis and the translation of knowledge while growing their ability to become skilled, compassionate caregivers and attentive patient advocates. In a study conducted by Beal, administrators, educators, and researchers agreed that an effective partnership requires shared vision, decision-making, mutual investment, common goals, and must be based on mutual trust and respect. Further, the authors found that personal relationships, open and free communication, and frequent contact and engagement were the foundation of successful academic practice partnerships. Further, academic practice partnerships serve as a unique strategy to reduce nursing shortages among participating healthcare facilities. According to Franson, a team is not just a group of people who are directed by one leader. Every person on the team has a role to play, and these combined roles contribute to the overall big picture. It is the responsibility of the nurse leader to help others grasp the big picture by continually keeping in the forefront a vision of where the team needs to go. The social process by which people interact and behave in a group environment is called group dynamics. It involves the influence of personality, power, and behavior on the group. Nazaro and Strasabasco describe the two most common roles affecting a group's effectiveness are the person who dominates and the person who remains silent. It can be as difficult to get the quiet person to speak as it can be to get the talkative person to talk less. Please read Group Dynamics and Team Building for detailed information on establishing group roles, problem solving, team building, and development. According to the Academy of Medical Surgical Nurses, mentoring is a reciprocal and collaborative learning relationship between two, sometimes more individuals, with mutual goals and shared accountability for the outcomes and success of the relationship. The Academy states that mentoring can guide nurses in their professional, personal, and interpersonal growth. According to the Robert Wood Johnson Foundation, mentoring helps cultivate nurse leaders, retain nurses, and diversify the nursing workforce. By strengthening the nursing workforce, nursing mentorship improves the quality of patient care and outcomes. The foundation identifies 3 specific benefits. Mentoring can foster the leadership skills that nurses need to secure larger roles in developing, designing, and delivering healthcare. Mentoring relationships inside healthcare organizations and academic institutions can help those organizations retain nurses and nurse educators, reducing the cost of turnover. Mentoring can help diversify the mostly white and female profession by supporting minority and male nurses. This diversification can lead to fewer health disparities within the population by providing diverse role models. According to mentoring guidelines from the Academy of Medical Surgical Nurses, successful mentoring relationships must be built on trust, openness to self-disclosure, affirmation, and willingness and skill in giving and receiving feedback. The guidelines state the following. The mentor and mentee must trust each other. They both must be willing to share information about themselves, including unpleasant lived experiences. They both must give constructive feedback, positive and negative. Mentors need to let mentees know regularly that they believe the mentee will succeed. At any given point in your career, you will have crucial conversations. These can occur with a coworker, a person in leadership, a physician or practitioner in another health science profession, or with a patient or family member. Crucial conversations are tools for talking when stakes are high by Patterson, Grenny, McMillan, and Switzer is a guidebook to set you up for success. Look around you. Who are the people in your life who can get things done? Who are those who are most respected? What attitudes, demeanor, and communication style do they bring to the table when stakes are high? How do these people become so influential? Consider this. Each of us enters conversations with our own opinions, feelings, theories, and experiences about the topic at hand. When this collective information is shared in the conversation, it allows others to open up and share their opinions, feelings, etc. Thus, everyone can add meaning to this collective pool of information. As the pool of shared meaning grows, individuals are exposed to more accurate and relevant information, which allows them to make better choices. When your addition to the shared pool of information is respected and validated, you will in turn respect and validate others. Thus, not only does this allow everyone to make a better choice, people are more willing to act on whatever decision is made. Crucial conversations take years of observation, practice, even more observation, and more practice. Successful nurse leaders will hone this skill over the course of their career and pass it on to their mentees. Next, we are going to discuss the importance of participating in professional nursing associations. Why join a professional nursing association? What advantages can be derived relative to the cost of membership? According to the American Nurses Association, professional development is a vital phase of lifelong learning in which nurses engage to develop and maintain competence, enhance professional nursing practice, and support achievement of career goals. Membership in professional organizations can bring you together with practitioners and researchers across the globe. conventions, conferences, webinars, websites, committee meetings, mailings, social media, journals, chats and forums, and newsletters are all ways to engage and network with peers across the country and globe. Through these activities, you can broaden your understanding of evidence-based practice applications and scholarship in your field of interest to benefit your agency and community and the patients you care for. Many specialty certification boards require you to take continuing education courses to stay up to date in your practice. Professional organizations offer these CE activities to members at reduced prices to meet these requirements. Professional organizations also offer discounts to certification review materials, nursing products and services, auto, life, and professional liability insurance, and may feature special financing offers. Many nursing organizations offer members an official journal that may contain peer-reviewed clinical articles and research relevant to their specialty practice. These associations also offer career advice and job opening platforms. Here are a few of the more than 100 nursing organizations. ANCC, the American Nurses Credentialing Center, has retired the Advanced Public Health Nurse certification. If you have previously received this designation, it can be renewed every 5 years. However, the National Board of Public Health Examiners does offer their certificate in public health. The link is provided on this slide. The school nursing certification is offered at many universities across the United States. Please see the links provided for more information. Certification in nursing requires a time commitment to your specialty, some significant study time and preparation for the exam, along with the expense of the certification exam itself. Once you have that exceptional feeling of accomplishment with the certification in hand, it will all be worth it. Certification in your specialty demonstrates that a nurse has the knowledge and skills to provide high-quality care to patients and their families. Certification is one way the profession demonstrates a commitment to safety, quality, and excellence of healthcare delivery.